Welcome back to The Short Coat, coming to you from the amazing and intense world of medical school, from the students drinking from that fire hose. What? That's old. Welcome back to The Short Coat, coming to you from the amazing, intense world of med school at the University of Iowa, Carver College of Medicine. I'm Dave Etler, and with me today in the studio, talking about the sorts of things that you bring from your previous life into your current study of medicine and your new profession. Here to help me with that, we've got M2, Nick Lemeziter.
Hello.
We've got M2 Samantha. Don't laugh at me. We've got M2 Samantha Gardner.
Hi.
We've got M2 Sarah Upton.
Hey, yo.
And we've got M2 Shrishti Mather.
Hello. This is just a random thought. You keep saying your past life, and I do believe in reincarnation.
Oh.
And every single time you say that, I'm like, how are we getting into this? This is a different topic altogether. This was not what was on the sign-up.
You brought it up, so from your past lives.
Oh, God. I think my past life was a cat, and it's pissed off that it's not one now.
I can see that.
Yeah.
I always say I
that.
wish I was a cat.
Right.
Yeah.
Yeah. I think I was in the past. I would like to be one in the future. Okay, back to the real point.
Tell me about some early patient interactions you've had. What surprised you about how you showed up for them? Because we do these things called early clinical experiences. You guys are not, you guys haven't moved from the preclinical phase to the clinical phase, but you have had some early patient interactions, and you've had interactions with people, patients at some of your jobs. What surprised you about how you were there for them?
I have one story that I'll try to keep brief, but over the summer, I participated in what's called the Summer Research Fellowship here at Iowa, and so you get to do a research opportunity, and I really wanted to do something clinical. And so I worked with a local community organization that I had ties with from my time here in Iowa City before, and I was able to actually go out and see patients who were on hospice. And so they were in the dying process. As we learned in the last couple of units, in order to qualify for hospice, you need to have a diagnosis, a terminal diagnosis of the next 6 months, essentially. So these are pretty sick people. And the first time that I went out to just deliver some medications to this patient that I had been visiting, they had kind of gone downhill. And so then it was just me and the nurse. I had brought these medications for the nurse to administer because I'm a medical student and I don't know what's going on.
Yeah.
But I showed up in my green scrubs, and as soon as I walked into the patient's home, the nurse started asking me questions about drug interactions with this medication that I was delivering. It was haloperidol, for those that we just learned about it. And I was like, oh, we just had that unit. Like, I know the mechanism of this drug. But I think because I had this outward appearance of someone who knew what they were doing, and I had the Iowa badge on my scrubs and everything.
Yeah. You looked the part.
I looked the part, and I truly did. From our education, I knew the answer, but it was so early in our career that my confidence wasn't there. But
hopefully
I
also you said, well, I'm just a medical student, but also.
Yeah, well, and I thought that was understood. My badge had student on it, but I don't know. This nurse was asking me questions, and so. But
was she pimping you? Maybe she.
Yeah, right. Yeah, the vibe in the room was very serious. And so I was pretty confident that she was actually looking for clinical judgment here. And so, but I projected the confidence, and I think projecting that confidence came from a lot of my previous interactions just with people in life in general, especially as we've been talking about working in the service industry. I think being able to match your energy to the situation and to tell stories to people, I think allows you to kind of assume different roles in different situations.
What if you're not confident? What's the professional thing to do in that situation?
Fake it. No, I'm kidding.
I mean, there is a little bit of that.
I think it's always best to be honest. If you don't know, please God, don't lie.
Mm-hmm.
Yeah.
Yeah. I mean, there is a little bit of that.
Better to look it up than to say the wrong thing
thing
and have something go terribly wrong.
Yeah.
Yeah. I would say as a previous teacher, that's a big thing that I learned that I carry forward. It took me a really long time to be okay with not knowing. And there was a point I remember teaching, when I was first teaching, I would prepare for every single lab. Okay, what possible question could a student ask? I want to be ready. I want to be prepared. And then at some point you get to a point where you're just there is literally no physical way, because students will ask you anything adjacent, sometimes not even adjacent to the subject. And so I got to a point where it's just okay, there's no way I will know every single thing. I can only prepare so much. And just being comfortable with not knowing and letting someone know that you don't know, but saying, figuring out a way to say, oh, hey, let's look this up together, or like, I'm not sure, or I don't know, let me look it up so I can confirm. That was definitely a big lesson that, like I said, took a while to get used to, but has been very, very helpful as a medical student.
And overconfidence, I don't know how many students suffer from overconfidence, but I imagine it can be a pretty dangerous situation.
Yes.
Or at the very least, make you look like an idiot.
Later
Also,
on, yeah.
yes.
Mm-hmm.
Was there, can anybody think of a time when they were overconfident and they got slapped in some way? Either by life or by some human?
I feel like our past experiences make that less likely. There have been times where I meet people who maybe didn't do that, who like jumped straight in from college, and I want to slap them.
Yeah.
You're doing the slapping.
Yeah. Or I'm like, you don't know anything.
Yeah.
And I know I am the youngest here in this group, I think. I am already kind of naive, but like there are people younger who I'm like, I will slap you if you keep talking like this.
I've had people blatantly tell me wrong information that like I know is wrong from working in
Very confidently.
like fields of medication and like have spent time learning that, and then just very confidently tell me that like completely the wrong answer and make it sound like they think I'm an idiot for having the question or thought or whatever it was that prompted them to tell me this wrong information.
Do you respond to that, or are you just like, okay?
Well, if it's in class, sometimes you just got to let the facilitator handle it.
I mean, for sure. In that situation, absolutely.
Sure, there have been times I've put my foot in my mouth.
Not you.
Oh no. Never.
No.
But it is a bit of trial and error.
Yeah.
Mhm.
And like
Yeah.
staring off into oblivion in the shower thinking about all the things you did wrong.
Or like the worst is when it's someone who is wrong and then you like tell them that they're wrong, but they are like, they will never admit it. And that's just like, there are some people like that. And it's like, it's okay. Like we're all going to make a mistake. Like you don't have to be rude about it. I'm just letting you know. And like, that's kind of where the immaturity kind of comes in. I see a lot of like people not admitting, oh yeah, I can make mistakes too.
Yeah.
Or the absolute like breakdown if a mistake is made. I've seen it the other way too, where they don't perhaps like overconfidently react and refuse to admit they're wrong, but like an absolute spiral if you've missed 2 on the exam and like this is a long game. It's gonna be okay.
Yeah.
And half the time the odds are like if you missed a question on something that's like not what you're going into, it's probably going to be okay that you didn't know that specific detail. Like,
Also,
do you know the overarching concept you were supposed to get from it? Yes, great. They'll tell you more later. And if you're not doing it in the future, like you can look it up when your patient comes in and has it as a comorbidity. It's really going to be okay if you didn't get it your first exam of med school.
What experiences have you been drawing on to communicate with people better or differently or in a medical way?
We talked about typing earlier. So to be a scribe, you do have to like show a typing test. So I got up to 120.
120?
Yeah.
Whoa.
I know.
I think
Gross words per minute?
I think I only ever topped
I don't
70
know.
or something. I thought
Yeah.
it was pretty
So
badass.
that's my communicating skills. No, but just like medicine is all about communication. Like that is the core of what you are doing. So any previous work experience that you have in that, so like again, like me working with those students and like learning how to explain difficult concepts to them, like that is something that I very clearly tie in and carry into my medical career.
Do you sort of, I mean, how do you, is there a sort of a general technique that you think about when you're breaking these things down for people?
Me personally,
Yeah,
no.
you personally. You're just
Vibes.
Vibes.
Yeah,
Love
I was
that.
going to say, I would say
I wing it.
for teaching, it's very much like they're definitely, if you're explaining either to one student or, a whole classroom, you can see the glazed over
Right.
look on their face. Like you can just get a vibe. You're like, this is not clicking with them. So it's like, okay, we just got to pivot, try to explain this in a different way. Because one thing that I was taught, which I think is very helpful, is if you ask someone, like, does that make sense? Or do you understand? They're probably going to say yes, even if they don't understand. And I think that can be applicable for a student learning. It can be applicable for a patient. So just not necessarily relying on them, but kind of relying on like, what's their body language? Do they actually look like they're kind of receiving it? Or do they look kind of glassed over? Oh yeah, I understand, nodding their head, but they're like very confused. So a lot of it's just vibes.
It was really hard as a patient to take in information sometimes. If you like, worst case scenario, you've just received a diagnosis that you didn't want or you didn't expect. I imagine that there's a moment where you have to sort of process that diagnosis before you can process the treatment or what we're going to do next kind of situation.
That is how they teach it. Yes.
Yeah.
But
I don't know that that's how it always happens. There were some kind of icky anecdotes that they told us when they were teaching us to do it that way. But
I'd like to know more.
no HIPAA will be
Violated.
But a woman came and talked to us about when she received her cancer diagnosis.
Oh, yeah.
Yes, and they had called a hallway phone
To tell
in
her
the
that.
clinic.
Oh yeah.
And I think the front desk worker told her there was a call for her on the hallway phone in the clinic, and it was somebody who very quickly told her that she had cancer and then hung up, and that was it.
Odd.
So that was
That's crazy.
bad.
Mm-hmm.
Who?
Yeah.
Who?
I think it was a radiologist.
But wow. Wow. Okay.
Yeah, I remember us hearing about that
I
last year.
actually think about it from time to time. It's actually appalling that is something
Yeah.
that happened like
Mhm.
relatively recent. Like this is not back from a while ago. I think the implication was that it was within the last 10 years.
Yes, that
Yeah.
sounds
Mhm.
correct.
So it happened recently.
But it was not at the University of Iowa. It
No.
was at a community hospital.
I just can't imagine somebody going, "Oh, that's the right thing to do. That's
Yeah.
the reasonable
Yeah.
way
No, I
to do
know.
this."
I think especially like given the fact that we have access to our medical records at any time and like so frequently we'll get test results and like radiology results before we've even had a chance or like the physicians had a chance to look at that. I think that also like stresses it out. Like I personally had to have like some imaging done and I was reading the thing before I got any like info back. And I was starting to spiral and panic and I knew what the words meant. And like I knew what was happening and I knew realistically like, okay, XYZ steps up ahead. But like even then I was panicking and I would have really like I needed my doctor to like talk me through these things.
It makes me wonder if that doctor on the phone was trying to outpace the medical. And they were just doing their best in a shitty situation. I mean, to be charitable about it.
I even think in the opposite of that. So I also had imaging done, and it ended up being that my CT was unremarkable,
Mhm.
which I do have thoughts on calling people's organs unremarkable.
My organs are very remarkable, thank you.
but
These are the best organs.
Good news for me, my organs are unremarkable, or they were 2 years ago, but they never followed up with me. Like I had a CT with contrast, at least full half of the body, and nobody bothered to call and be like, there's nothing wrong, and we will not be pursuing this further, even though clearly things had gone wrong, that I was getting a full body CT. And I don't think that's great patient care either. It's less reprehensible than telling someone they have cancer on the hallway phone or sending out test results that have things that have scary words on them without talking to your patient first, but it's still not great.
All right. Well, what do you wish you had known about all of this stuff that we've talked about? What do you wish you had known before making the leap to med school?
I think I definitely err on the side of underconfidence in medicine.
Mm-hmm.
And I think like it would be helpful for me to have more faith in a little bit of the growing that I did before I came to med school. And like have more confidence in some of my abilities. So that's me personally.
Yeah, fair. I think it's. I mean, given imposter syndrome and all that, it's a pretty common problem for a lot of people. And it's hard to be confident until you're actually able to demonstrate it, too, right? Like a lot of what's in your head at this point about being a physician remains solely in your head. So you can't really. It's hard to demonstrate it to yourself in that situation. So, what advice would you give?
Take a gap year.
Oh, yeah.
That's a given. Yeah, at least one,
Take
maybe
a gap
more.
year. Yeah.
So don't jump right into med school.
Yeah.
Yes.
I don't think I would have survived med school if I
Yeah,
did
no.
that.
And honestly, I kind of think that for me, I think the admissions committee kind of knew that because I had applied a couple of times. And so I think that they were like, yeah, I think she has some growth to do. And I appreciate them for that.
Yeah.
I also took 2 times to get into med school, and I feel like a lot of times people said, well, if you weren't willing to apply again, then you shouldn't be willing, that shouldn't be the path you want to take. And that's fine. But I also think that the people who say that they wouldn't have done it if they didn't go straight through, like that should maybe be a flag to yourself that you need to evaluate a little bit more. Obviously, we are not at the other side of this yet, but one day we will be. And I think if you get to the other side of 8 years if you count undergrad and med school, 12 years if you count undergrad, med school, and residency, if you get to the other side and you hate it,
That's a problem.
That's rough.
Yeah.
So I think taking that extra year or 2 in between, as somebody who took 6-ish years in between, it will make a difference and it will be okay and you'll fall back into the swing. But if you can only do it if you can push straight through, I think you need to think about it a little bit more.
Well, hey, Shortcoats, if you want to tell us something about today's episode, about a topic you'd like us to cover later, if you have a question, just go to theshortcoat.com/tell us and send us a message. Otherwise, that's our show. Until next time, I'm Dave Etler, saying don't let the bastards get you down. Say bye, everybody.
Bye.
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 Bye.